Hey everyone, my name is Kristen, and I'm here to give you a quick 2-minute rundown on what you need to know about placenta previa. Let's review. In a normal pregnancy, the placenta attaches to the wall of the uterus. The fetus is attached to the placenta via the umbilical cord. The placenta provides oxygen and nutrients to the growing fetus and removes waste products from the fetus's blood. In the case of placenta previa, the placenta implants itself in the lower uterine segment. There are 3 different types. A complete placenta previa completely covers the internal os. Imagine the inside door from the uterus to the outside world is being blocked by the placenta. The only way for the neonate to be delivered is via C-section. A partial previa covers a part of the internal os, partially blocking the neonate's exit through the cervix. A marginal or low-lying placenta previa is when the placenta has attached very close to the internal os. Oftentimes, as the uterus grows, this type of placenta previa will resolve itself. The presence of a placenta previa is confirmed by ultrasound and then closely monitored throughout pregnancy. Patients can present with painless, bright red bleeding that often starts in the 3rd trimester. Depending on the type and severity of the previa, a patient may need to remain on bed rest and plan for a cesarean delivery. The biggest risk here is hemorrhage. Severe blood loss affects both the mother and the fetus. So when a patient presents to labor and delivery with complaints of bright red vaginal bleeding, there are a handful of things that must be done. Obtain a focused assessment to include vital signs and vaginal bleeding for character, color, and estimated amount. Do not ever perform a digital cervical exam on a patient who presents with bleeding or has a known previa. Instead, a sterile speculum exam may be performed by the provider. Hook the patient up to continuous electronic fetal monitoring. Obtain IV access in labs such as hemoglobin, hematocrit, and type and screen. Obtain obstetrical ultrasound as ordered to confirm the placental position, estimated gestational age, and fetal position. And remember, always provide patient education and emotional support.